I am showing 12 o'clock, so we're going to go ahead and get started. This is Tanya Williams from the Office of Early Childhood, and just want to take a moment to welcome you all. Please, if you would mute yourself so that we can hear the guest speakers. Keeler can do that. Keeler, if you'll just mute everyone, I think that will help with the noise level. Thank you.
Tanya, you're muted.
She would like to cover some things about hand washing because it's a very important thing during our time with young children. So, Michelle, I'm going to toss it to you and let you talk to the early childhood folks about this very important thing that we need to be doing.
Perfect. Thank you. Like they said, I'm Michelle Osman-Buckin. I am the health educator for outbreak prevention and response. My main job duty is prevention. So today we're going to talk about hand hygiene and how it's important and just basic reminders. But hopefully you'll learn something new today. You can advance. Okay. So like I said, we're going to talk about hand hygiene, reflection, and next steps. And I will say these slides were made for healthcare workers, but I do think that they apply. Next slide. Okay, so today we're going to learn about 2 reasons why having clean hands is especially important in healthcare and why hands are a main way that germs can spread in the environment. Next slide. Okay, so what hand hygiene is, it means cleaning your hands by using either hand washing, which is washing hands with soap and water, antiseptic hand wash, antiseptic hand rub, alcohol-based hand sanitizer, including foam or gel, or surgical hand antisepsis. If you're using hand hygiene or hand like sanitizer, it needs to be 60% alcohol-based. And you can go next slide. Okay, so this one doesn't really apply to this picture, but it can. So as you can see, this person is coughing and then they are touching their hands. And hands are the main way that we get germs into our body. We can spread them everywhere without knowing it to other surfaces, things, and other people. Especially in daycares, you're going to come into contact with many things like respiratory droplets, saliva, maybe even blood and waste, and you're more likely to touch other people. When important things to remember is that we are heading into a virus season.
I labeled some, Erica, with the name on them.
Okay. Especially with kids starting school. Okay, can you go back? Thank you. Okay, so kids are starting school. They touch everything. They touch their mouths, they touch their hands, they touch their nose without washing. And so we just need to be diligent about making sure that our kids are washing their hands before lunch, after every single bathroom break for 20 seconds, after playing, that everybody is washing their hands after every single diaper change. And making sure that the toys are getting cleaned, things like that. Washing our hands are the #1 preventative way to protect ourselves. Okay, you can advance. This one's going to be really quick, I promise. So in healthcare, for example, we touch 900 services in any given day. And you think about that, like I am a face toucher. Like I'm always touching my eyes, my nose, my mouth. So I'm very diligent about at least using hand sanitizer or hand washing. You want to make sure you're not using hand sanitizer when your hands are visibly soiled, right? So if there's anything on your hands at all, you're going to want to use soap and water for at least 20 seconds. And then I want to talk just 1 second about cleaning. So when we're cleaning or anywhere, we want to go high to low, clean to dirty. And no, it doesn't make a lot of, it sounds backwards, and I always have to think about it, but clean to dirty. And you want to do bathrooms last. And then always make sure that when you're using your cleaning products that you read the instructions and that whatever you're cleaning stays wet for the recommended amount of time. And it's surprising, but a lot of the cleaning products, the dwell time is what we call it, is 10 minutes. So you want to make sure that it stays clean. Otherwise, it's not going to work as efficiently as it should. So always just make sure to check the back of it. Um, so, like I said, we are coming up on virus season. You know, pertussis is high, hand, foot, and mouth, things like that can get very high during the next couple months. So we just want to make sure y'all are setting reminders about hand hygiene. And I can send y'all flyers or posters or anything like that if y'all want to hang them up. And then if y'all need any kind of resource, like I am a resource and I want to be a resource. So if y'all need me to come talk to your particular daycare or a daycare setting, just let me know and I can do hand hygiene. I can do cleaning and disinfection or anything like that. But when you are cleaning your hands, make sure you get under the fingernails and breaks in the skin. I almost broke out the Glow Germ, but I didn't think I'd have enough time. So when you're cleaning, make sure you get, like I said, the backs, the fronts, underneath, in between the fingers. A lot of people miss that, and make sure it stays for 20 seconds. Okay, you can advance. Okay, like I said, it was really fast, short, and sweet, but I just wanted to make a reminder. If y'all have any
Michelle,
questions?
thank you so much, Michelle, for coming on and sharing. This is one of the most important things we can do in early childhood gang for prevention. I cannot stress it enough. I know, I think I testified during COVID at the Capitol about how our children are literally probably eating boogers, touching the floor, and then touching everything. That they're curious, so their hands are going everywhere on us, and it is just so critical that we wash our hands and keep our babies and young children safe. So,
Right.
as Michelle said, we're going into that season with lots of kids coming back together, maybe more kids coming back into the facility, maybe some new kids, maybe some new babies that will start as we begin a new school year. So we just wanted to honor our folks at the Department of Health. They stand ready with resources. We certainly can take some of the pamphlets here, Michelle, and make sure that we get those handouts to our programs through our local leads. So local leads, if you guys are on and want to get those resources for the providers in your particular areas, let Michelle know that. And I know the Department of Health will be glad to share those resources so that we can get them out to our programs and just as a reminder for washing hands. So again, thanks so much, Michelle. I think Onika is up next. If you have any questions, Michelle may hang out with us for a minute and you can put it in the chat box so that she can answer anything. Onika is going to talk to us just about screen time, which is another important thing in early childhood. And I just want to start with this. The reason Onika is on here is for some of you who are in state-funded pre-K, Arkansas Better Chance, we had an opportunity in the early spring to do some piloting of the Atlas test that's in K-12 or K really 10. And I was really surprised by some of the feedback I got from my ADE colleagues in K-10, K-12 that our program said things like, we're not allowed to do this, we can't use that much screen time. So I went back and started looking at regulations because I was like, this is for 3 and 4 year olds, and the regulations are a little bit different. So I wanted Onika to just come on and remind us, and then I just want to talk to you guys for a few minutes about screen time. So Onika is very specifically going to talk about what's in the regulations for childcare licensing, which I hope will help remind everyone. But as we go forward, I want to make sure that we're all very clear and that we don't have confusing information for our teaching staff and for each other. So, Onika, I'm going to let you take it away.
All right, thank you so much. All right, so as Miss Tanya said, this is really just a reminder, and this information is definitely in your licensing reg book. It's just one of those sections that's pretty much overlooked a lot of times. So screen time activities. The use of television, digital, versatile disc, DVDs, video cassettes, computers, or video games, and other screen time activities shall meet the following regulations. A, shall be prohibited for children younger than 2 years of age. The use of DVDs or other video programs for any activities with this age group would have to be approved through an alternative compliance request. B, shall be limited to programs of educational value which are age appropriate. C, shall be scheduled and shall not exceed 1 hour daily per child or group of children. Children shall not be required to participate in screen time activities and shall be offered other choices. And of course, video viewing time may be extended for special events or occasions such as current events, holidays, birthday celebrations, or other occasional viewings of age-appropriate movies or other programs that may exceed 1 hour in length. And then D, educational computer learning periods for children below 5 years of age may not exceed 2 hours a day per child or group of children. Educational computer learning periods for children 5 years of age and older may exceed 2 hours per day. And that is the regulations that's surrounding about screen time. Thank you so much.
Thank you, Anika. I'm going to leave those up for just a minute because I do want to point out it is prohibited for children under 2, and we really believe screen time should be limited as these regulations suggest. But I want to talk about what happened with the pilot for Atlas because we were talking about children that were older, generally 4-year-olds that were going to be transitioning to public school. And if you look at D, first of all, it was a pilot, so this would have been outside of any normal thing that we would do. We were just working in cooperation with our colleagues here within the department, really to help inform them for kindergarten Atlas assessment testing. So it wasn't to be used on our children in any kind of way other than what can we learn with children who are getting ready to go into public school or into the more formal education process that could help them do a better job implementing this tool in the kindergarten setting. We are working with our team, and at some point in the future may have an assessment with Atlas for early childhood, but that is not the case today. This really was just a pilot. But when you look at D, the educational computer learning periods, like that allows, and there was no screening. I talked to the folks doing this, and my staff went out and did assessments. There was nothing that would have even gotten close to the 2 hours, which really would have fit within that time period. So I just want to make sure that staff who are on here, directors, owners, like you, make sure your teaching staff know that, educational opportunities are different than just sitting children in front of a TV or really young children in front of screens. So again, we want that screen time to be very limited, but we want to make sure that you have the actual facts and the rules. So thank you, Onika, for reminding us what is in the current promulgated licensing regulations about screen time. And the other thing I would just add is if you have questions about that in your program, if you are a program that's doing, any kind of request to pilot or try something, and this happened very quickly, by the way, so we know we could probably do a better job communicating out, and definitely took some cues from what happened maybe to do that better next time. But I just wanted, it really surprised me that folks maybe didn't know what these rules are, and I wanted to make sure that we knew. So thank you so much, Onika. And I think our next speaker is Brandy to talk about some things in the School Readiness Assistance Program.
Good afternoon, everyone. We want to try to just kind of bring your attention back to the care type changes that we experience in between summer services and back for the regular school year. So our team member, Grace Norton, is going to talk to you a little bit about care type changes. Grace.
Thank you, Brandy. I'm Grace Norton. I'm a program coordinator with Provider Support. This time of year, as we're heading back into school session, you will need to make sure that the children who are in other programs, such as ABC Federal Pre-K, if they're receiving funding during the day by Medicaid, or if they're over the age of 5 and attending elementary school, that they do not have a full-time authorization during regular school session. We do not permit billing full-time for school-age children during regular school session, but those other funding sources also includes preschool children or children of other ages who receive funding through other sources. When you're receiving your new authorization worksheets for these children, you can find those in two places in your SRA portal. They come first to your notifications page on when you first log in, and then you can view them again under the Reports tab by selecting Authorization Worksheet. You can search by the name of the child or the authorization number, and it'll have a chart there showing you the care types for the calendar of days that the authorization covers. We do key according to school schedules, as long as we have that calendar, but if changes occur, we may not be notified of those. So please utilize your ticketing system. That's the best way that you can get this communication done is by using tickets. You do have that direct contact information for the worker who keyed the authorization on that worksheet, their email and their phone number. And then if you're having trouble reaching anybody, which you shouldn't if you're doing a ticket, but I'm going to go ahead and drop my email as well. Because you can send that, if you're a provider sending that information to me, we can assist with getting that where it needs to go. And then with Federal Pre-K in particular, I am aware that ABC asks facilities to upload all children into COPA regardless of their funding source. But we did have some confusion last year because some children who are only being billed and paid through school readiness assistance were also entered into COPA as a Federal Pre-K child. So make sure that you're not entering them twice. And that's all.
So I wanted to just add on to that. We see this oftentimes when say you may have a 4-year-old that's actually going to attend an ABC program and they're going to come to you for aftercare, or your program also houses the ABC program. So just please be diligent about making sure you review those authorizations and notify us of any change in that authorization that needs to happen. Because as you all know, we're in a wait list, so we want to make sure that we're being responsible with our funding, and we don't want to have any repayment of funds because we've paid you twice. So just please let us know if anything needs to be updated.
Thanks, Brandy and Grace. Appreciate you all for sharing that today. We're in that transitional period, so just be paying attention, especially if you're doing both programs. But we do find occasionally where providers maybe have a child that was enrolled in something in the summer and aren't aware of a change. So we'll try to catch that. We're working on our side to do the same, but we wanted Brandy and Grace to share as we go into the next week or two as school starts back. So thank you guys so much. And next up, Jennifer's going to talk about class and fall town hall meetings.
Thanks, Tanya. Well, good afternoon, everyone. This next year, 25-26, we are going to refer to as our class transition year. And you can see on this slide, our goal is that every classroom that receives public funds will have at least one class observation. And we really just wanted to share this with you today. So these will all be coordinated through your local leads. But as your local leads start reaching out to you, hopefully many of you are already certified observers. So you may have the opportunity to observe in your own center or a center in your area, but they are also hosting training so that you can become a certified observer. So if you've not done that yet, I highly encourage you to either become an infant toddler or a pre-K certified observer, because you can see at the bottom of this slide for 26-27 for our full implementation year, our goal is that class will be one of the main measures that help drive our quality rating system. And so it's very heavy on quality adult-child interactions. And so if you are not a certified observer, please connect with your local lead and they can help you become a certified observer. And then the last thing we just wanted to share briefly, if you can go to the next slide, is our fall town halls. Tanya's done several of these over the past probably year and a half. These are very informal, just to kind of share updates about early childhood, but these are the ones coming hopefully to an area near you this fall, through the month of September into the first week of October. So please connect with your local lead or write these dates down, and we will hopefully see you very soon. And I think that's it for me.
Thanks, Jennifer. We look forward to coming out into the communities. Many of you probably know we pick a different community. This will be our, I think, fourth or fifth round of these. And so we may go to one time a year where we're doing them, but we've picked different communities every time, and we will continue to do that. Some are smaller communities, some are larger communities, but we won't hit the same areas probably at all. We'll just continue to expand that out to different communities so that we give lots of opportunity to people who are in more rural areas, et cetera, and just work with our local leads on those. But it is a time for us to share and to really listen if there's anything that we need to be made aware of. And there have been a number of things over the last 2 years that we've heard in these meetings. So we look forward to it and just encourage you, if you're able to attend, this time frame for the month of September, and then we have a final one on the 1st of October. So very excited about that. I see Paige has dropped in the local lead contact information if you need that for your class information. I do want to say that someone asked me about this class transition year, and they used the words pilot, and they were told not to use that. I do want to let you guys know we are very much in a pilot. This is a pilot. We're just calling this year the transition year as we're moving through that pilot process. So the LEARNS Act call for us to pilot, and we have a time frame and a timeline for that. So if you call it a pilot, that's okay, but we're calling it the transition year. Last year was the beginning of our pilot for the class tool, but this year will be our second year in the pilot, and it is called a transition year for us. So just wanted to make sure you were aware of that. So if you slip up and call it pilot, we're not going to be upset with you. It's okay. I think maybe that is really it for today. I know that many of you are busy getting ready. Some of you might be getting training. Some of you may be in Jonesboro this week for the big ASA State Conference. Some of you might be getting ready for back to school events. It is that time of year, and even though our programs continue throughout the summer, we do have kind of a reset usually at this time of the year as we lose some children to start kindergarten and say goodbye to some kiddos maybe that we've served for 4 or 5 years. And we welcome some new children sometimes at this time of the year. So I hope you all have a fantastic start to the year. I would remind you there are no throwaway children. They're all going to come to you the way they are. Some days will be really easy in the next few weeks. Some days may be a little hard. Just remember they're very tiny and their little brains aren't very well developed, and they may not be able to communicate to you maybe all the things they're feeling, but they're going to a new place perhaps, and it can be scary, or maybe they're in a new classroom. So just remember that we are brain architects here. We're here to help them navigate the learning and help put all the good things in there so that they'll have a successful, not just this year, but that we build that school readiness and that ability for them to learn and be lifelong learners beyond the time that we have them. So I hope everything goes smoothly. If you need us, you know how to reach us. Several people have put information in the chat box, but don't hesitate to reach out. We look forward to a fantastic school year. Our next meeting is September 2nd, and maybe cooler temperatures will be on the way as we go into September and into the fall. But I wish you all well and look forward to seeing you in the town hall meetings and our next meeting on September 2nd. Jennifer, it looks like you have something.
There's a question in the chat, Tanya, about news on retirement. I don't know if you want to address that before we hop off. And then there's one on class observations in the pilot that we can answer as well.
Okay, yeah, that I'm guessing you're talking about the law that passed that would allow teachers who are in licensed programs who receive state funds or federal funds through the Department of Ed to participate in Arkansas teacher retirement. Just so you all know, we do not administer teacher retirement in the Office of Early Childhood or even at the Department of Ed. It's another agency. My colleague and friend and former colleague from DHS, Mark White, is the leader there. They are working on the rules. That is, they have to promulgate rules for that. But we have seen those rules and we're very excited about it. It will likely be the first of the year. There are some rules get passed quickly because they're emergency clauses. Some things happen later. But just stand by as those rules are promulgated, even though we're not the ones running that rule through the process, we will be bringing it. And we'll likely have Mark or some of his colleagues at Arkansas Teacher Retirement come on to talk about it. But I do want to emphasize it is for programs that not only are licensed by the Office of Early Childhood, but who also receive funding from the Department of Education. So that those were things that were in the law. And so just stand by, be patient. They're working through their process just like we are. I think we have two other rules that we're working on. One is going to be in our new child care licensing regulations that we were already changing, and those are in the approval process. So we're waiting on approval, and then they'll go to state board to be approved for public comment, and then they'll come out for public comment. So we'll be keeping you guys apprised of that, and also your local lead. So just stay in contact with your local lead as well. And then the ABC eligibility change that we'll be having. So just know that we're working very as quickly as we can on all these rules, but we'll have someone from teacher retirement. It's a great question and real exciting that our programs will have an opportunity. Thanks, Jennifer, for calling it out. Sometimes I check the chat box, I missed that one. So hopefully that's everything again. I hope you guys have a great start to the new school year. And we look forward to seeing you out there around and about. Work with your local lead, learn about class, get class certified as an observer in your program, or have someone in your program get certified. Call your Head Start colleagues. They have somebody in their program who is certified. That is a federal rule for them as it's part of their federal review process. So good time to get to know them. But enjoy the rest of your day and this week and look forward to seeing you. Take care.